So welcome everybody to the meeting of the Council of Governors. Just as Debbie said, I just wanted to set the scene. Ordinarily, Kevin would be welcoming everybody, but I'm sure that everybody's noticed from the agenda that the very first paper that is going to be presented to you is about the Trust Chair's annual appraisal, which Debbie as lead governor will be presenting. So given the conflict of interest, Kevin hasn't joined at the beginning of the meeting. It seemed far more sensible from a logistics point of view for him to be invited in when we've received that paper. So without further ado, I'll invite Debbie to present that paper, and then we'll get Kevin back in, and then we'll start the meeting in the normal way. Okay, Debbie?
Thank you very much. I'm actually really pleased to be presenting this paper to the Council of Governors because we are quite unique in the fact that we make our chair's appraisal public, and I think it speaks to our values that we do that. And the paper which summarises that every governor, director, other key stakeholders have been invited to contribute to that appraisal. Again, I think it's very positive about the approach that we take to this. So the findings of the appraisal went to the Nomination and Remunerations Committee and are now presented to you. But I would like to summarise that it was a very broad-ranging appraisal. There was some very positive feedback, and we took the opportunity to thank Kevin on behalf of the Council of Governors for his hard work the last 12 months. We reflected on the feedback and agreed a range of objectives for the next 12 months. There were no previous objectives to monitor performance against, but these we will do in 12 months' time. So they're in no particular order. There's a broad range of objectives. We've kept them to a manageable amount. I think it's really important with any appraisal not to have lots and lots of objectives, and hopefully you'll see things that matter to you reflected in those objectives. We would like to ask the Council of Governors now to receive this report on the Chair's appraisal, note the levels of performance and the objectives set for the next 12 months. And this will then be shared with NHS England in line with the framework for all NHS Foundation Trust chairs. Happy to take any questions or add any further information if required.
Can't see any hands, Debbie.
Okay, thank you very much. That paper is then noted, Karen, and then I think there's another paper further down the agenda, but we could perhaps invite Kevin to come back and join us now.
I'm just about to invite him in, and I'm sure you'll give him some feedback, Debbie, when he comes back in. Still calling him.
Okay.
Don't think he's in yet.
All right. While we're just waiting, I will just mention that further down the agenda, you will see the minutes of the Nomination and Remuneration Committee. And basically, it's a very short paper that refers to this and the appointment of the non-exec director, which we'll cover later.
Good afternoon.
Good afternoon, Kevin. Welcome.
Good afternoon.
Sorry if it took a while. Took a while for me to arrive. I came as soon as Karen sent for me.
Thank you. We've just covered the process for the chair's appraisal. Took the opportunity to say how very pleased on behalf of all of us we were with the appraisal, and how the fact that we share this appraisal, the findings, your objectives, Kevin, and make it public, I think really speaks to the trust values and the sort of openness that we wish to conduct our business with. I would like to say again, thank you very much on behalf of all the Council of Governors for your hard work, your efforts in the last 12 months. We know it's been kind of unique, and you've really risen to the challenge. So thank you very much on behalf of all of us. The paper has been received, and I don't think there's anything else I need to say at this point, Kevin. So perhaps you leave it to you to pick up and carry on with the agenda. Oh, can I just see a hand from Karen?
Thanks,
Karen?
Debbie. No, you haven't at all. I just wanted to say thank you to you and your colleague governors for providing their feedback and taking the time to complete the appraisal. That goes to directors as well, but particularly the governors. So thank you very much.
You're welcome.
Thanks, Debbie, and thank you very much to you and everyone that took part in the appraisal process. It's a privilege to be chair of LPFT, and I am flattered and gratified by what you've said in your feedback, Debbie. So thank you very much. Let's go on to then the formal agenda. Karen, do we have any apologies for absence?
We do, Kevin, but we normally record those rather than read them out. We'll record them in the minutes. Thank you.
Indeed, that was my opportunity for you to say that. Do we have any declarations of interest other than those already made? I don't see any. So let's move then to the minutes of the meeting held on 21st of April. Does anyone have any comments on points of accuracy? I can see a hand up, but I can't see whose it is. Tim.
Sorry, Kevin, that was an accident. It was a slip of the finger. So
okay, that's all right. An accidental hand. So does anyone have any comments on points of accuracy or matters arising from the minutes of the last meeting? If the answer is no, are colleagues content for me to sign them as an accurate record? Excellent. Thank you very much. I haven't got any matters arising, and nobody else has indicated matters arising. So we'll move on to the schedule of actions, item 1.6. There are 7 actions on there, all of which have been noted as complete. Does anybody have any comments or questions about those actions? I don't see any. Thank you very much. Item 1.7, as usual, there are, which is the minutes of the Board of Directors meetings in March, April and May. As usual, those are available on the website. So if anybody has any questions about those, I'm more than happy to answer them, either now or offline, as they say. I don't see any. So thank you. Move on then to item 1.8, which are comments from the chair. I haven't got very many, and I don't want to steal the chief executive's thunder in terms of her comprehensive report later. So there are three things that I really want to say, and I'll be brief. The first is for the record, to express my continued gratitude to staff in the Trust who continue to work exceptionally hard in challenging circumstances, not least with another peak of infections from COVID-19, which has had a significant impact across the organisation. And to recognise that mainly because of that extraordinary hard work, the Trust continues, as we'll see in the performance assurance report later, the Trust continues to perform remarkably well in the circumstances. And in the circumstances, in those challenging circumstances and increased demand and so on. So I just want to express my gratitude for that. And then finally, I want to welcome Jenna Davis, our new Director of Corporate Governance, to the Trust on behalf of the Council of Governors. So welcome, Jenna. That's it from me. Happy to take any questions on any of those remarks. If there are none, I will move on. I think I'm right in saying, aren't I, Karen, that Bex isn't present this afternoon?
No, unfortunately, she's submitted her apologies, Kevin.
So I will present on her behalf the minutes of the Representation Committee held on the 19th of May. If anybody's got any questions about those minutes, I'll be pleased to do my best to answer them. I don't see any, so thank you for letting me off lightly on that. We'll move on to item 2.2 then, which are the minutes of the Nominations and Remuneration Committee held on the 15th of July. Debbie. You're muted, Debbie, still. Sorry.
Thank you. Happy to speak to these. They're self-explanatory, really. We held the meeting virtually to approve the appointment of the non-exec director. Well, actually, to recommend to the Council of Governors to approve the appointment, and they're here with you now. Just to explain that we had two very good candidates the last time we went out to interview for non-exec director, and that it was just, I think it's around or just less than 3 months since we advertised. And so rather than go out to advert again, we approached the second appointable candidate, Mr. Ian Orrell, to ask if he was still interested, and pleased to say that he was. And so we would like to ask the council to approve his appointment, please.
So it would be convenient, I think, if we took item 4.4 now, which is the note that specifically asks for approval of Ian's appointment. So if we take Debbie, the minutes of the meeting and that item together. Yes. So in 4.4, there's a short paper that sets out both the process, the recommendation for appointing Ian, and a brief pen picture of him. So the proposition for the Council of Governors is to approve Ian Orrell's appointment as non-executive director. Happy to take questions. Debbie and I can field them between us on either the process or the candidate, if there are any. If there aren't, if you could signal your approval for his appointment, I'd be very grateful. Michael, is that your hand up? Fire away. You're on mute.
Yeah, yes, it is my hand.
And I've seen Emma's as well, so you're next, Emma. So sorry, go ahead, Michael.
Yeah, I certainly agree with the appointments there. Good candidates.
Thank you, Emma.
I was just signalling that I agreed, that was all.
Oh, okay, right, sorry, that's me
right.
getting confused. That's great. Good. Excellent. Well, thank you very much, Debbie, for introducing the minutes and enabling me to do 2 items for the price of 1 on the agenda. So, and I'm grateful to colleagues for approving Mr. Orrell's appointment. We'll move on then to, if we may, to item 2.3, which is the activity report. Shana, I think that's you.
Hi, yes. So I'm here to provide just an overview of the report. I think it was to be taken as read, but I'll kind of give a brief overview as well. So in terms of this submission, firstly, thank you to the governors for submitting their submissions. We had quite a range of different activities that we've included as part of this. We start with representational meetings. So we've had some representation at veterans groups and also at some men's mental health groups I think in the northeast of Lincolnshire as well. We've also had inclusion within focus groups. So that is the Building Together focus group, which kind of predominantly focuses on the eradication of dormitories. We've also had inclusion in panels. So that is from recruitment panels, as well as staff awards panels. So agreeing who's going to be shortlisted. We've also got vlog recordings that governors took part in. So that's for drop-ins for the elections and also for the promotion of the elections as well. We've had a range of face-to-face that we're happily organising now as well. So we've got 15 steps quality visits that a range of governors have attended. And there was also an older people and frailty event that we had a range of governors at as well, which was brilliant to see. And we've also had inclusion with a NED induction. So Chris met with Debbie and I believe Jackie Tyson as well. The list of events at the bottom of the page is just some upcoming events that governors can also take part in the next quarter. So we also have upcoming, we have some more 15 steps quality visits. We also have the second part of the CEO roadshows that governors are invited to attend. We have drop-ins, which the first is planned for the Peter Hodgkinson Centre, where governors can come meet service users, families, visitors, and kind of make themselves known, just to kind of from a representational perspective. We have Freshers Fair event that governors can get involved in, as well as Lincoln Pride, which I believe has been done previously prior to the pandemic. And we also have, not listed actually, I believe in the report, but we have some upcoming opportunities in complaints review, focus groups, patient experience focus groups as well, and some podcasts that governors can get involved in at their own request. And that is very much a non-exhaustive list on there, but the opportunities that will be coming up will continue to be listed in the Governor's Weekly as well. So I'll defer back to Kevin.
Thanks, Shanna. Any questions about that? For my part, it was I was able to take part in 2 of the CEO roadshows, and it was fantastic having governors along, and it was nice to meet Emma in person and Carol. So it's you know, I think reflecting on that, it's amazing how little we get to know each other really on Teams, and how it limits the opportunity for kind of casual exchange. And I enjoyed, you know, both of those events for that reason. Di.
Thanks, Karen. I just wanted to say that I thought it was a really impressive list of activities, you know, across a whole range of spectrum. So I just wanted to make that point, but also just to ask, as the incoming chair of Quality Committee, I could see that overwhelmingly the comments were positive, but whether there was anything that governors just wanted to draw my attention to in terms of that committee going forward. No, that's absolutely fine, but I just thought I'd ask the question. Thanks.
Is there, Di, I mean, you might not be able to answer this as incoming chair of Quality Committee. Is there a mechanism for governors to feed in any, you know, kind of any issues or concerns they may have to Quality Committee?
There are a number of ways that can happen, Kevin, and we did, in terms of the quality report, we did reflect in that governors obviously will discuss the quality priorities going forward. They may be involved in approving business cases that relate to service improvement plans. So there are those formal mechanisms, but I think as well, I think it's worth a think about that, because also how we triangulate some of the information that comes from the non-exec visits as well that we do with our executive colleagues. So maybe that's something that I could give some thought to going forward.
Yeah, I didn't have anything particular in mind and thought perhaps I ought to know the answer to that, but decided that I didn't. So okay, thank you. Any other comments on 2.3? If not, we'll move on to the iLog.
In terms of this quarter's iLog report, we had 6 iLog submissions between April and July. Essentially, we had 5 submissions from governors and 1 submission from a member of the public as well. These started from the first relating to additional governor roles, so wider consideration for representation. This is being referred to the new Director of Corporate Governance, as there are quite a lot of steps that we have to take when considering a new governor role, especially in line with the Constitution. Bus fare costings were also part of the second iLog that we received, following concerns from staff members. And after this was raised at the executive team meeting, a scheme is due to be introduced in September. So it's through Stagecoach, and staff essentially get a discounted rate. There was also a submission about digital health passports, and the author of that submission met with our informatics team just to discuss the procedure in line with pre-existing policies and GDPR as well. We also had submission, which was from the member of the public, about mental health support in market deeping specifically. This submitter was signposted through the relevant governor to the relevant services, and also it was agreed that the Better Together magazine would be distributed to the local community centre, just to give a bit more representation in that area as well. And the final, the penultimate, should I say, submission, we have staff governors wanting more representation as part of the induction process. So to help with this, communication was made with the HR team. We have a slide in the group induction, and we also have inclusion within the local checklist that all staff come across when they start. And finally, the final submission was in relation to Grantham's crisis team. So just some feedback from service users and staff. This feedback was passed on and is being considered as part of a larger review that was already taking place as well. And I'll defer back to Kevin in case there's any comments or questions.
Thanks very much. Are there any comments or questions on the iLog? Emma?
Yeah, actually, I've realised I did have a question for 2.3. I do apologise. I wrote it down and I got lost in my notebook.
That's quite
I was
all right.
going to just ask about the mental health liaison team. Who do you go through to join that, or ask to join that? I was just interested in that. That was all. I hadn't realised that there was something that kind of met and did that.
Sorry to interject, but I can potentially help with that one. Is it the Expert by Experience group, Emma, that you're referring to?
No, it just said mental health liaison team on the governor activities.
Ah, that Rebecca does.
Is it Rebecca then? Yeah.
Yes. Well, I facilitate the group, so maybe you and I could have contact off. I'll put my email in the chat, and I can liaise with you about that. Would that be okay?
Okay. Yeah. No, that's fine. Yeah. Lovely. Yeah, that's all it was. Thanks.
No worries.
Okay. Thanks. Thanks, Emma. Thank you, Laura. I don't see any other questions, Shana. Thank you very much. Let's move on then, and I've lost my agenda, but I think, Sarah, the next item is the Chief Executive's report.
Thank you, Kevin. Hi, everyone. I'm Sarah Connery. I'm Chief Executive executive here at the Trust, and I'm here to present my Chief Executive report. So in the usual way, it talks about sort of national areas of relevance and traction, and then regional down to Lincolnshire and then into the Trust. But I will start and just build on, and then happy to take any comments or questions in the usual way. I will take the paper as read, but just tease out some areas that I want to bring to your attention. As Kevin said, we have had significant operational pressure, not just from increasing demand for services, but also because of rising infection rates as well. And for those of you that have been visiting services, you will be asked to make sure you're wearing a mask and following infection prevention and control guidelines. And we did have to take the difficult decision to postpone the staff awards event, which was due to take place on the 14th of July. But a massive thank you to our comms team for being able to sort of lift and shift the event to October. And a massive thank you to those governors. It's been captured on the activity who took part in the shortlisting, which is no mean feat given the number of submissions that we have. So thank you, but all is not lost. Fingers crossed we'll get there in October. Just overlaying the operational pressures, we'll be aware of some very extreme weather that we've been having recently. So in the report, just wanted to really bring people's attention. You know, this is the first time that we've had a level 4 heatwave alert from the Met Office. We are experiencing a climate emergency, but we are pulling together as an NHS system and wider to make sure that we're being sustainable, responsible providers in the county. And we have made some traction in some areas, but much more to do. So that's noted in the report. In terms of national events, I've just pulled out 2 national take reports there, one on the future role of primary care and also NHS leadership, and I'll do further updates as that work progresses nationally, and then what it means through Lincolnshire. I just wanted to point out, I've talked about it in previous reports, but we do work on wider footprints than Lincolnshire as well for some of our specialised services. So across the East Midlands, we form an alliance with other mental health trusts across Derbyshire, Nottinghamshire, Leicestershire and Northamptonshire as well, where we pull resources where it makes sense and try and make sure that we've got streamlined pathways. And we had a really great patient safety event where we heard from service users and carers, some really impactful learning together around what it actually means, for example, to be in a prone restraint, both good experiences and bad experiences. So I was delighted to open that event, and one of our service users actually won an award at that event as well. So, and we're going to build on that moving forward. In terms of Lincolnshire, the Lincolnshire Integrated Care Board, we've talked about this in previous joint boards as well as at Council of Governors about the Health and Care Act and the new NHS infrastructure that comes into play. So the CCG has now been sort of wound down and has become the Integrated Care Board. I do have a seat on that board with as a sort of mental health, learning disability and autism partner member, to make sure that we have got representation for some of the most vulnerable people in our population. We've only had 2 meetings so far, but I think there's some great opportunities there for connecting services. It's a real broad representation from not just local NHS providers, primary care, local authorities, elected members, as well as voluntary organisations and other community providers of care, health and care. So I'll keep you posted on how that's going. Just wanted to point out really positive visit from Taiwan. So we had a ministerial delegation to learn about some of the great work we're doing in terms of our community transformation, trying to share the learning across the system and the region and the NHS, but internationally is a really great coup for all of the fantastic work that's going on there. We did talk at the previous Council of Governors around the Nightlight Cafe rollout. It goes from strength to strength, but we are still struggling in terms of getting a location in Skegness, and we're trying to be a bit creative and looking at potentially a sort of peripatetic bus, which could be in Skegness and the surrounding areas on at various times in the evening through the week. So that's something that we're looking at. I did agree as part of my actions to feedback on the Walking in Your Shoes retention programme. We had about 100 responses, I think, so not quite what we were expecting, but there was some definite strong themes in that about stress and burnout, as you might expect after a very operationally pressured past few years. And something that we're really taking to heart is around greater flexibility of working hours for staff. And that's something that we're taking up through the people team to work that through. But we are going to have more dedicated sessions going forward again, so it won't end there. Obviously, a massive cause of concern for all of us is the increase in the cost of living, and we're trying to support staff as much as we possibly can within, you know, the remit of what we're able to do. Just want to point out a really great older people and frailty conversation event that we had. Jackie Tyson's pointed that out, and thank you again to the governors who took part. And I just want to commend the Older Adult and Frailty Division for all the great engagement work that they do. They're an absolutely shining example in the system of what good engagement looks like, and a big thank you to Laura and the engagement team as well. Kevin talked about the Chief Executive roadshows. We've kind of paused them through the summer, but we're collating all the feedback that we've had from staff. Great to have governors there with us, and if others can join some of the future events, we've got sort of Skegness coming up as well. We obviously have to keep an eye on the COVID infection rates, but you know, time together physically to get into some really deep conversations with staff about how it feels to work in our services is absolutely vital. And finally, I just want to say a personal note, Andy Spring left the Trust on the 15th of July, one of our non-executive directors, and he was, when I was Director of Finance, a key support for me in that role. So just want to formally wish Andy all the best for the future as he moves on in his retirement from the role. Celebrating success, I won't go through it all, but some fantastic potential wins there for us for the Francis Willis unit, who've been shortlisted again for the National Service User Awards. I know, Kevin, you're hoping to make the event on the 14th of September, so do wish us luck for that. So just want to finish by saying a massive thank you to our staff for all that they do each and every day, and a big thank you to our governors for helping us be the trust that we aim to be. So thank you for your engagement. And I'll shut up there, and I'm happy to take comments and questions.
Thank you, Sarah. So questions for Sarah. Debbie.
Hello, Sarah. Yes, thank you very much for an excellent report as always. Really like the efforts that are being put into engagement and connecting with people and seeking feedback. My ask is just about governor engagement with your Chief Exec roadshows, because I've struggled, particularly during the last couple of years, to connect with people in South Kesteven and hear what's happening for them, or staff that work in South Kesteven. I kind of wanted to come along to one of the roadshows, but couldn't because other governors had already booked the places that were allocated for governors. I wonder if it's just worth thinking about when there is a public governor for an area, whether or not an invite could go to them first of all, as to whether or not they want to accompany you, or if you're doing a roadshow in a children's service, whether there's, just to think about how those places are allocated, because it was a missed opportunity for me to know what was happening locally.
No, that's an excellent challenge, Debbie, and I hadn't clocked that we'd capped it, to be honest. So I'll pick that up in the sessions going forward. Thank you.
Thank you.
Thanks, Debbie. Sorry, my Teams is being very, very slow. Emma.
Hi, Sarah. Great report as always. It's about the Nightlight Cafe rollout again, because I was just something just popped in my head, because there is quite a few Methodist churches in Skegness, So I didn't know whether any of them could be approached, maybe. You know, I walked past one this morning. That's what just made me think about it. You know, because there is quite a few dotted around.
Yeah, I've been told that all avenues have been pretty much exhausted, but that doesn't mean we can't go round the loop again.
Yeah.
And ask. So you know, we'll keep on it. But
yeah, it was just something that popped in my head, so I just thought I'd sort of drop it out there.
Thank you.
Okay, Tom.
And Carol.
Yeah, I just wanted to carry on Debbie's point. I was one of the governors that signed up to the roadshow in Grantham because there wasn't a roadshow in Sleaford. And in fact, I note that in some future events, again, Sleaford is missed out. Probably because North Kesteven sort of slips into Lincoln, doesn't it? It covers quite a big area. But I have to say to Debbie, I was one of those governors that crept into South Kesteven from North Kesteven because Grantham's just along the road. But I wanted to say that I thought the ethos created at the roadshow was, you know, very supportive. I thought it was great how the staff were relaxed and felt totally able to express their views, because you know, a couple of staff did talk about challenges and they spoke that in a very honest way. So I thought that was very good, and that for me also reiterated the ethos of the 15 steps visits, where again I feel that staff can talk freely, and again it's to me there's this, I don't know whether it's deliberate, whether it just happens, the ethos that is created is non-judgmental. So from what I've seen at the CEO Roadshow and in the 15 Steps visits, that staff can talk freely and there is a non-judgmental ethos. And I certainly felt that if staff wanted to talk more, they could contact members of the trust, and it's a very supportive ethos that's been created.
Brilliant, thank you, Carol. And that's so important, that we create that environment. So great that you could you know, see that in action. I've certainly felt very challenged in some of those road shows, and that's how I want to feel. You know, it's great to have the good, the bad and the ugly, and then be able to have a feedback loop as well to make sure that we can say, look, these are your challenges, but this is what we're doing about it. So yeah, thank you. And Joe's just put in the chat about the dates for the second set of road shows. And so we'll pick up the point about Sleaford definitely, and make sure that it's as inclusive as possible.
I don't know whether you've spotted, Sarah, but there's also a request in chat for an update on the medical director recruitment.
Yeah, shall I come in on that now, if that's
yeah,
okay?
please, if you could.
Yeah, so thank you, Sunitha. So we've gone through a very challenging recruitment process. We've used an external recruitment company to sort of design and lead the process. We had, thank you to governors and non-executive directors who were part of the process. We also had system partners involved, as well as members of the regional medical management team as well. So I'm delighted to be able to say we've appointed Girish Kunanigri, who is the Deputy Medical Director at Leicestershire Partnership Trust currently. We have done a smaller media release, a communications release rather than anything big bang to date, because there's so many hoops that you have to jump through in terms of executive appointments in relation with NHSEI as well, and make sure that we're aligning our communications with those of Leicestershire Partnership Trust as well, who are obviously very sad to see the back of Girish. So we're hoping for a start date sometime in the autumn, but again, that's not currently confirmed. So I just want to take the opportunity to say a massive thank you to Dr. Jazz Full, who's been the acting medical director since Ananta's departure. So massive thank you to Jazz. But happy to answer any comments or questions on that.
Thanks, Sarah.
It was a bit too late to get it into the report, sorry. So that's why it's not in the written report. Thank you.
No, timing on these things is always difficult. Sorry.
Hi, Sarah. Thanks for the update. I don't know, can you hear me? I don't have the raised function, hand raised function.
Yep, you're fine. We can hear you.
Yeah. Okay, yeah, thank you. Yeah, thanks for the update, Sarah. We were, it's just not knowing after we did come to know, all the medical body did come to know about the interview date, and we did not hear about the outcome for a very long time. So it was that uncertainty left the medical body feel, why are we kept in dark and not being informed and open about it?
Yeah. No, I appreciate that, Sunita, and we were pushing to get responses. There's so many hoops to go through. It just got very dragged out, and we had to get NHSCI approval, which again added delay to the process. So I apologise if that's how it felt, but in the background there was medical HR and myself very much pushing for being able to share information as soon as possible, but apologies that's how it felt.
Okay, yeah. Thank you for sharing.
Thank you.
Thanks, Sarah. Are there any other questions on the Chief Executive's report? If not, thank you very much, Sarah, for, as usual, a comprehensive and really helpful report. Very grateful. Thank you.
Thank you.
Move on now to item 3.2, the performance assurance report.
Kevin, you've gone on mute.
Sorry, I don't know how that happened. You'd think by now I was used to how Teams worked, but obviously I'm not. This is where I invite non-executive directors to speak to their element of the assurance report. It would normally, the SINED would normally introduce this item, but Sharon isn't around, so I'm doing it. This is, I think, the third run out for the assurance report in this format, which has committee chairs offering their take on the assurance provided by their individual committees. I'm going to hand over to each of them in turn, starting with Di as chair of quality.
Thanks, Kevin. So in terms of quality, I've mentioned already that we, when we did the annual quality report, we added clarity in that report around the role of the Council of Governors. The infection prevention and control item still continues to be an area that is of concern. There has been a quality committee since the one in April. There was one on the 14th of July, and we've taken further assurance that all things are being done to improve that situation. And the Director of Nursing has taken on chair of the IPC committee, so to ensure that the action plan is being delivered. So I think we've got good assurance there. But at this stage, we took a decision at the July Quality Committee not to change the level of risk associated with the infection prevention control item as on the quality risk register. And then finally, in terms of the other items that are there, we've seen a number of reports coming through, both in the April meeting and subsequent in the July meeting. In terms of the dual diagnosis service that's mentioned there, I attended actually recently one of the special interest groups relating to dual diagnosis, and learned quite a lot actually in terms of what we're doing, both in terms of the meetings that are being used to discuss particular issues in terms of providing care to individuals, but then the special interest group, which focuses much more on the way that we're joint working with colleagues within the wider system, including colleagues from the criminal justice system. So I'm happy to take any comments or questions on the quality element.
Thank you, Di. Are there any questions for Di? I don't see any. So then we'll move on to the Sustainability Committee. Chris.
Thank you, Kevin, and it's great to be here. It's my first Council of Governors meeting, so I joined on May the 1st, so I don't think I'm allowed to call myself a newbie anymore. The first Sustainability Committee I attended was on May the 12th, and Tim Harry kindly chaired that to give me a bit of a induction. So my first committee is next week, actually, on the 11th of August. Just if I may take a bit of an indulgence and just give you an observation of my opening few months in the trust, I just want to say how impressed I am by what I've seen and the quality of the exec team and the rigour that's applied to the strategy and the delivery. I think I feel very fortunate to be involved, and looking forward to the next period. The Sustainability Committee has helped develop a 5-point monitoring plan, which looks at finance, procurement, digital, estate, service demand and capacity. In the recent past, the focus of the committee has been on the continuing transformation of community rehabilitation services and the future of Ashley House. There's also been a focus on the eradication of dormitories, and the work is progressing very well in Lincoln. Unfortunately, the situation in Boston is more complicated. Given the inflationary environment, the costs have risen considerably, but Mark and his team have been working tirelessly to try and find a solution, and are in active conversation with NHS England about what a solution might look like, and a business case is currently being pulled together, which will hopefully result in some additional funds being made available, but we'll see if that comes to light. And then there was, in relation to children's services, there was a deep dive in terms of CAMS, and as you know, there have been some fairly long waiting lists, but we've also benefited from some new investment, and we're starting to see the impact of that with those waiting lists shortening. In terms of the next period, the area of focus is going to be around the review of our establishment, looking at new roles within the establishment, looking at how the mental health investment standards money has been spent outside of LPFT. We're going to also be reviewing our own commission services and looking at the future of our own growth investment through the MHIS. Those are my comments, Kevin.
Thanks, Chris. Any comments or questions for Chris on sustainability? Emma.
Hi. I just wanted to ask about the children's services waiting list that you spoke of, because I do know that, because I do sit with a lot of parent support groups and involved with a lot of them, and they do always state that they do have to wait such a long time. So with you stating that the list is beginning to shorten, do you know what kind of time frame is on that then? How long are they going to be waiting for?
Thanks, Emma, for the question. I'll look to Chris to give a more detailed answer than I might be able to provide.
Okay.
Chris.
Yeah, hi Emma. Yeah, so I think at the moment, we really just started to turn the corner. It's going to the trajectory for getting weights to where we want them to be is quite a long one. It's going to take probably 18 months to get where we want to be. And we've just really started to tip that corner as we brought some staff online. But we've got a lot more recruitment to do, and as you know, that's just taking a bit. It's a challenge at the moment in terms of getting people into post. But started to see the positive signs. What we're targeting at the moment is those people waiting the longest. So we're trying to do an assessment quite quickly, and we're doing reasonably well with that and seeing people in a matter of weeks. But it's the wait between that assessment and then starting treatment that's a particular problem. So we're at the worst points, so January, February time, were the number of people waiting up to a year for that treatment, and so we've targeted that group to try to reduce the number of the longest waiters. So we're now, I suppose it varies on where you are in the county, but Lincoln's seen a reduction in those longest waiters. So we're still talking kind of 7 or 8 months before people are seen, but a lot of it will depend on the need of the person and the risk. So that initial assessment that we do determines the risk that's posed, and so people with the highest risk will be seen sooner. So it does vary from person to person. I can't give you an exact figure on the number. I can get some data to you after this meeting if that would be helpful, just to give you kind of the profile of the spread of different weights. But there is still a number of people that are waiting potentially 10, 11 months to start treatment. What we're trying to do in the meantime, though, is recognizing that's quite a long time to start for some people, is we put in some family liaison workers so that we've got some support going into people to be able to access some help and guidance whilst they're waiting, to make that wait as positive as it can be, recognizing it's not ideal for everybody. So, and also tapping into kind of community involuntary services sector to put wraparound support for people whilst they're waiting. But I suppose the assurance I can give you is that those with the most highest risk are seen more quickly and don't wait as long, and we have a kind of dynamic risk assessment process where we're making contact just to check that risk hasn't changed over time. But if you want some specific data on numbers, I'm happy to share that.
Yeah, okay. I mean, the thing is, if they've had an initial appointment and then they've got to wait nearly a year for treatment, that can have a knock-on effect with parent carers, because obviously that can put them into crisis. Because fair enough, you might have a diagnosis of what's the matter, but then if you've not got the treatment, they're kind of in limbo.
Absolutely, and that's why we've introduced these new family liaison workers, so that we can keep that contact, and if that risk changes, the need changes, we bring them in sooner. But unfortunately, it's a national problem that we've seen across the country, and it was a kind of significant number of people coming presenting for treatment, and that just demands outstripped capacity. The positive news is that commissioners have understood that and invested, and we've got considerable investment coming into the service. It's just taking time for us to be able to recruit those people in, but we're looking at different ways of doing that, linking in with the schools and other things, so that we can provide support in different areas as much as possible, but recognising CAM's specialist treatment is limited by the capacity of the service at the moment. So
but the thing is, though, it always has been, I'm afraid to say, it always has been a nightmare trying to get an appointment. There's always been long waiting times, and that's been over a number of years. It's not just recently.
No, indeed. So I think we know that our CAMS services for a long time have been the only door for people. That's the only place for people to refer to. And what we've tried to do with Healthy Mind service, which has been really successful in supporting people in that kind of low-level support and short-term support, and now obviously investing in community in the schools, of mental health support teams in schools, but concurrently to trying to increase the capacity of the core CAMS team. We're working with our local commissioners to do a full transformation and review of community and all children, young people, mental health services in the county. What we're doing there is just looking at the totality of the resource that's available and saying, right, how can we use this to best effect to meet the people of Lincolnshire? And what we need is a different approach to what we've got, which has been very focused on curing and solving problems as they arise, and try to get more preventative help in. And a bit like we've seen with the community adult transformation, where we've invested in community capacity building assets so that we've got support for people in their own communities. We need to do the same for children and young people. So we are doing something kind of here and now to increase the workforce to try to address that. But we recognise the model's not quite right for Lincolnshire, and we definitely need to sort the issue out of people being repeatedly referred into CAMS and waiting, and it's just currently not working for everybody. So we do need to sort that out in that longer term piece of work.
Thank you.
Thanks, Chris. It's fair to say, isn't it, that there is an ongoing challenge to the trust in terms of triangulating resource with demand, and workforce with the continuing level of vacancies that we've got. And there is, it's an ongoing challenge, an ongoing job to make sure that we triangulate those and manage those competing demands. Sarah.
Yeah, just to add to what Chris has said, I mean that children and young people's transformation programme, it's very wide ranging. It is proper transformational, so it won't happen overnight. But one area where we are getting some good traction is around support for autistic people. So we have talked in the past about needing community hubs, which other systems have got. So I know there's a trip up to North East Lincolnshire next week, where our leads will be going and sort of seeing how that works, where with a view to putting in a pilot in Lincolnshire within this calendar year. So there is traction. It's unfortunately for the people who are waiting isn't going to happen overnight, but we are on it.
Thanks, Sarah. Let's move on then. I can't keep track of my papers. Here we go. We're moving on, I think, to People Committee. Tim.
Yeah, thanks, Kevin. First of all, apologies for the longer than normal section on the People Committee. That rather reflects the full-on meeting that we had in June. So what I've previously reported on is the assurance behind the Trust's highest risks around recruitment and retention. And at this last meeting, we it culminated in a thorough review of all the mitigations now in place. So, for example, that includes the workforce pipeline, which is a forward look on requirements, looking at the impact of the various recruitment routes. And this is now at both an organisational level and has granularity to be able to be applied at divisional level, and this helps with the decision-making process. We've got an increasingly maturing workforce dashboard. International recruitment now is in full swing. We're starting to see the impact of that. Looking at new roles, looking at a review of the recruitment process, alternative recruitment routes. And then also on the retention side, Sarah mentioned about walking in your shoes. So we're beginning to understand more about what keeps people in the trust and why do people leave. So I'm really delighted. I'm pleased to say that substantial progress has been seen, although recruitment retention remains high risk and a significant challenge as we continue. So a big thanks to the people team who have led the charge on this progress. Part of what next is around a major review of the workforce requirements and establishment review. So, do we really need all the posts? Can we look at utilisation of new roles which may have easier routes for recruitment? So really good progress made across that areas. Further highlights from the last meeting: staff survey, excellent results. We looked in particular at benchmarking across the region, and yes, we came out well in that. So we're not complacent about this. Improvements have been seen, but there's still work to do. We reviewed a suite of equality and diversity reports and made recommendations through to the main board. Again, significant improvements seen, but work still to do. And I think one of the aspects of this is discussion at the board development session was about really what is our ambition in these sort of areas? How far do we really want to go? And then finally, just to mention about people policy and remuneration of service users and carers, where acting as experts by experience. So the principles been agreed. Some of the detail is still to be worked up. So I think those were the key highlights, Kevin. So obviously happy to take any questions.
Thanks, Tim. Any questions for Tim? No, I don't see any. I think, Tim, the floor's yours because you're nobly stepping up to talk about Audit Committee as well.
Yeah, so apologies, it's me again, but I'll try and vary my tone a little bit. Anyway, so Audit Committee, been again a really busy period with a number of extraordinary meetings on top of the planned meetings, and this has been because of the timing in the year. We've been reviewing key parts of the annual mandatory reporting. So in summary, gaining assurance that how the trust is doing its stuff is effective and giving us the wanted results. So a number of areas around this, accumulation of a number of reports from internal audit around areas of investigation, external audit, counter fraud annual report, freedom to speak up annual report, finance, so the year-end accounts, and the governance trust and how well that has been applied. Again, all very positive, and where any partial assurance or only partial assurance has been obtained, we made referrals to other committees to pick up. I think the thing to emphasise around these are primarily around in the internal audit areas of investigation, but in the planning process, we ask and agree with internal audit to particularly focus on those areas of concern or risk or challenge. So we know that the areas that may need sort of further work. So I think, again, Kevin, that was an outline and key summary.
Thanks very much, Tim. Any questions on Audit Committee? I don't see any. Thank you very much. Look, the purpose of this report is to provide the Council of Governors with assurance that non-executive directors are properly focused on the right areas of performance and to enable governors to hold us as non-execs accountable for our engagement with the performance of the trust. I think it's a really helpful report in that respect and tells a good picture from my perspective in terms of how we're engaging with the performance issues that the trust faces. And that's not ducking the fact that those performance issues exist. I would be much more worried if governors were saying, oh yeah, but you haven't said anything about vacancies or you haven't said anything about the financial position or whatever. The intention of this is to demonstrate that as committee chairs and board members, non-execs are properly engaged with the performance of the trust and focusing on the right issues. And I think it does that, and I hope colleagues will agree. Debbie.
Gotcha. Yes. Yeah, I'd just like to say thank you very much for this format of the performance report. I can't speak for other governors because I've not had a chance to hear what they think about it, but I really do like hearing from the committee chairs. I like the fact that we're not overwhelmed with numbers, and it makes a lot more sense to me. It feels understandable to me and reassuring with this approach. Thank you.
I'm grateful, Debbie, and appreciate those comments. Thank you. If there aren't any other questions or comments, then we will move on to item 4.1, which is the forward plan that goes to NHS EI. And I don't know, Mark, whether you or Jane are kicking off this.
Yeah, thank you very much, Chair. I'm happy to pick it up and talk through
Mark.
it. Excellent, thank you. So again, I'll take the report as read, but just pick out some of the key highlights really. So in terms of the key deliverables for the NHS over the next 12 months, there's obviously rightly so a big focus on delivering the long-term plan and actually coming through the other side of COVID and restoring services back to pre-COVID levels and starting to build on that really. So you can kind of see within the paper, there's a lot of focus around elective care, getting people back into hospital for those routine operations that they've possibly not been able to get to, reduce pressures on urgent and emergency care, look at specific service transformation. So that's around COVID recovery, you know, reduce the number of beds within hospitals and pulling forward, and ultimately just using our resources more effectively. So obviously in terms of LPFT's impact and what does that plan mean for us, we've touched on two of the very hot topics during the conversation already around our focus on children and young people's mental health services and the adult community mental health services. But there are a number of key bullet points on page 3 of the report that, you know, that they're some of the key service areas that we're really pushing forward on this year. Apologies, Debbie, I'm going to talk a few numbers now as we go through the financial update. But essentially what this section is trying to tell us is that when we went through as a system our original financial planning position, so we all brought our assumptions to the table and said, this is what we're going to spend next year. We started off at a position where we were going to spend just shy of £33 million more than we were going to get in as a system. So we had kind of committed to planning that financial deficit for the year. As all of the regional plans have been collated nationally, there was a significant deficit financial value for the NHS across the country. So you can imagine that hours scaled up, it would have been a really big number for the national team to look at. So on the back of that, there's been a real push to drive for efficiencies and offer additional funding to systems to try and help us all get to that break-even position where we only spend what we get in. So as part of that kind of movement into a revised plan, the system was offered £14 million from NHS England Improvement to help improve our financial position, on the basis that we're asked to stress test our own planning assumptions so that we can actually get us to that break-even position. So as a system, we're asked to find savings of just shy of £19 million. The majority of that has been around reviewing of investments. So, you know, are we investing in the right areas? Are there any investments across the community, acute or mental health that we can pull back on or we can kind of work on? So we've had some really you can imagine quite challenging discussions around that to get to this break-even position. But in terms of the impact of that for us as LPFT, so because we were already planning a break-even position, we were asked to improve our financial position and look at how we can make it even better to help support the overall system position. So the table on page 4 gives us the 3 key areas that we looked at. And I think the first one, that additional vacancy savings, that's a theme that's come out throughout this entire meeting. You know, we are genuinely struggling to recruit and retain members of staff across the service, which from a quality viewpoint is a really difficult position. From a financial viewpoint, it means we're not spending as much as we were planning to spend. So on the back of that, we kind of took a bit of a kind of assumption that over and above our draft plan, there will be even more savings in terms of harder to recruit posts, and we may recruit less than we were even saying at the start. So quite a prudent position, but it's important to note that at no point have we said stop recruiting. We're not holding any posts, we're not stopping anything progressing. If we need bank and agency support into services, we're allowing that to come in. We're not pausing anything. We're just trying to reflect the fact that the labour market out there isn't where it was, and we are still struggling to meet that. So these revised assumptions basically resulted in the trust planning a £3.25 million surplus. So that's our contribution to getting the Lincolnshire system to that break-even plan position. And what I would say for those that have read the integrated board report for month 3, we're achieving that. So we're realising these savings that we put into that plan as well. So it does show a degree of confidence in the assumptions, really. And the final thing that I did just want to pick up on, and to be fair, Chris has picked up on a bit more detail, the eradication of dormitories, that is a significant capital scheme for the trust for the next 12 months. It's by far the biggest capital investment we've had as an organisation. So the Lincoln scheme, the 2 wards at Lincoln, they're well on track. We're due to have building handover in January at the start of the year, and we're looking for services to commence in there from the 3rd or 4th of April, Monday, the first Monday of April 2023. So really positive work on Lincoln. There's some great pictures of the site which I'm happy to share, and we are looking to try and arrange visits on the site when we can make it safe enough for more people to go down and see it. It's really impressive. In terms of the Boston site, Chris touched on, we have had more challenging difficulties around agreeing the right place to build that, and where do we build it? Do we look at Norton Lee or do we look at other areas? There's been some really challenging detailed discussions both with NHS England, the local system, councils, all the stakeholders that we can get involved. We've really worked hard to make sure that we come up with the best proposal that we can, and I believe we have now. And that business case, as Chris mentioned, is going to Sustainability Committee this week. So hopefully we'll be getting approved and we'll be progressing it through for a funding request from NHS England Improvement and the Department of Health and Social Care. So what I was going to propose, if it's okay, Chair, that for the next Council of Governors meeting, we'll bring that business case and a bit more detail around it, because we'll know about the funding application, where we're at, to the next Council of Governors meeting. So I'll leave it there, but happy to take any questions.
That sounds entirely sensible, Mark. Thank you. Jackie.
Thank you. Mark, I was just, and I'm sure this is the case, but I'm just conscious of the fact that LPFT was in a relatively good financial position, and we're aware that some other partners in the system were in not such a good position. And are we in danger of being almost penalised in as much that we are trying to bail them out?
It's a great question, Jackie, to be honest, and it's an area that I didn't pick up on the report, but because nationally we are governed by the Mental Health Investment Standard, there is a guaranteed minimum investment in mental health across the system. Now, globally, our contract is only half of that. So across the county, we spend about £190 million on mental health, and we receive about 90 of it. So whilst that investment standard is there to guarantee investment in mental health services, we're working with the Integrated Care Board and their finance teams to understand where every penny is being spent and making sure that we're getting the most from that. So there is a degree of protection, but you're right, we are in a financially challenged system at the minute.
Just to add to that response, Mark, and correct me if I'm wrong, and Jackie, I hope I've understood your question correctly. What we're not being asked to do and what we're not doing is cutting LPFT services to save money in order to bail out other partners in the system. What's happening is where we are saving money essentially because we can't recruit enough people quickly enough, those savings are in effect offsetting other partners' overspends, but we're not giving up anything as a result of that, if that makes sense.
It does. I suppose my challenge was that we could perhaps use that money, that saving, elsewhere in other investments. And for example, the Boston site, we clearly needed more money for that. So could we not have diverted money from the underspend on staffing somewhere else? I suppose that was my only challenge, although I recognise that we are part of the system and we do need to support the system.
I think there are two factors in there, and Mark will be more technically accurate on this, but we can't use running costs to subsidise capital expenditure. So the answer to that is no, we couldn't do that because it's different kinds of money. Or that, however bizarre that might sound, there's something called that there is a capital limit that we can spend as well as a running cost limit, and yes, we are part of a system, and it swings and roundabouts. We're on the swings or the roundabouts at the moment, but roles might well be reversed at some point. So that is, I think, the price for being good system players and benefiting from the system as much as others benefit from us being part of it.
I suppose it's just ensuring that it does work both ways.
Yeah, and I think that's what the exec team and the board are committed to making sure happens.
Thank you.
Sorry, Mark, I hope I haven't stolen too much of your glory.
No, that's fine. Thanks, Kevin. I just want to add on to the back as well. we are throughout the year looking at where we can reinvest some of that non-recurrent spend. So a great example, we've agreed some additional agency support provision through our IAP services, so the psychological therapy services. So rather than hold the vacancies, we're bringing agency in. So we are being as proactive as we can to spend it non-recurrently rather than committing it for years in the future.
Thank you both.
Thanks, Mark, for adding that. Carol.
Yes, I think a lot of questions are being answered as we go along by other people's questions. Do you think the recruitment process will improve? Do you think that, you know, the shortage of labour will improve? I think we live in tricky times, don't we? And also buried in the report, you know, is that sentence, living with COVID. I just wondered if there were actions in place to deal with recurrent waves of COVID, because I'm sure we're not out of the woods yet. So, you know, will we, as we move towards autumn and winter, have another wave of COVID with more staff sickness, you know, and more vacancies perhaps? And I just wondered if what Lincolnshire's experience is also being experienced by other trusts, you know, are other trusts in exactly the same position, that Lincolnshire isn't either, you know, in a worse position or a better position than other trusts, that this lack of workforce is, you know, across the country. I think, you know, we have to be so supportive of the trust, because we live and therefore work in tricky times. And I think, you know, you're having to balance huge amounts of money and make priorities. And one of my questions was, which Kevin answered, does striving for efficiency mean less services? And you said it doesn't, which is good to hear. But it's tricky times.
Thanks, Carol. So a couple of observations as chair, and then I know that Sarah wants to comment. Part of my job as chair and my non-exec colleagues' role is to make sure that execs in the trust are doing everything they, you know, possibly and reasonably can to address the kind of issues that you just talked about. Now, it would be a crushingly naive person that sat here and said, yes, we can sort out all of the workforce issues in the next year, because you see, as you say, you know, we are operating in an extremely tight labour market. What I can do is say, you know, on behalf of my non-exec colleagues, that we're satisfied that the executive team are shaking all the relevant trees as hard as they can. If you follow the analogy, and that's, you know, that's what I can provide, you know, assurance around, is that the right strategies are in place that, you know, all other things being equal, will deliver the results that we want. I think it's important that I say that as chair before I ask Sarah to comment in more detail if necessary. Sarah.
Thank you, and I see Tim wants to come in, so I won't steal his thunder as chair of the People Committee. But it's a national problem, but we need a local flavour in terms of some of the solutions. That I think it's one where we've fought hard for additional mental health investment, and then we've had additional mental health investment, but the pipelines just haven't kept up nationally. So I think we're trying to play catch up. So the pipelines are now more in place in terms of, I'll say future nurses and doctors, but that could, what I mean is the whole workforce. So as well as those areas, it's looking at new roles as well, you know, what, and skills bases, rather than, you know, we can't recruit all of the qualified nurses that we need. They're just not out there, and people are offering more money over the border. So let's have a conversation about skills that are required. And look to, you know, voluntary community sectors as well in terms of the workforce there. So I won't say any more, because I know Tim will probably want to come in. But in terms of your challenge about COVID, we have literally just kicked off winter planning now. I know that's an odd thing to say when it's 26 degrees, but, you know, I think if COVID has taught us anything, it's that good planning and information can save lives. So we're working on that demand and capacity now, and, you know, we can't foresee what waves will come, but we will plan out a range of scenarios as an organisation and as a system to try and make sure we're as prepared as we possibly can be. Thank you.
Thanks, Sarah. Tim.
Yeah, thanks, Carol, and really good point, because I think we would have enough of a challenge around recruitment without COVID, and COVID sort of exacerbates it. Just a couple of things briefly to mention. One is around cohort recruitment, which I guess the principle is, rather than just waiting for a post to become vacant and then trying to recruit to it, trying to get ahead of the game. So if you're doing a recruitment in a particular area, well, if you get more good candidates, then I'm sure we would look to recruit and get ahead. I think the other thing is, and Kevin referred to this, challenging the exec team that are they doing the maximum, and one of the pieces of assurance around this is that quite a bit of the work that's been done by the people team is actually really seen in a very positive fashion by other trusts, other areas, and even nationally we're being asked about some of these areas. That's not to say that we're never going to be complacent, but it does demonstrate that some of our thinking and some of what we're actually doing, I think, is really, really good stuff and quality stuff in a very challenging environment.
Thanks, Tim. Sarah, do you want to come back?
I did, just to pick up on Helen's point, if you don't mind, because I think it's a really valid point.
No, thank you. I would have invited you to if you hadn't volunteered.
Thank you. Around retention, and it's something that's been picked up through the CEO roadshows and NED visits, and just being out and about talking to staff, is I hadn't quite clocked the amount of capacity that our clinicians are taking up doing administration and paperwork and feeding the beast. And yes, we need to make sure we've got really good audits for records and paperwork, but what we're setting off with is how do we free up our staff to do the roles that they love and train to do, rather than administration. So we're looking at, there's 3 pillars to it that we're looking at. So one is, how do you reduce the paperwork in the first place? So we duplicate in risk assessments. The second thing is, how do you get a snazzy piece of software that can do it for you through a digital tool? And the third element is, actually, we don't need a nurse or a doctor to do that. You need an administrator. So let's get an administrator in. And lo and behold, we might actually be able to recruit more administrators. So I think if we look at it along those 3 lines, we'll help people, because we can't pay more money than what Agenda for Change allows us to do. We can offer golden handshakes and things, but what I really want to do is make sure that we're giving people a job that they enjoy and they want to carry on doing, and that they can do the job that they professionally trained for. So I hope that answers. There are other elements in terms of staff support, wellbeing support that we offer, but that's the thing that's sort of keeping me awake at night at the minute. Thank you.
And just in terms of general focus, all of the workforce reporting that goes to board focuses just as much on retention as it does recruitment. And I wouldn't want governors to go away with the idea that we're only focusing in on recruitment. We're bound to focus on recruitment because we've got investment for new services. So that that is what it is. But we are just as focused on retention as we are recruitment. Your hand is still up, Sarah. Is that a new hand or just?
Sorry, that is very much a legacy one. Sorry, I shall put it down.
It's quite all right. Any further questions for Mark? Mark, that's been really helpful. Thank you. And thanks for the report, which is really clear and comprehensive as usual.
Thank you very much.
And look forward to further and better on Norton Lee when the time comes. I have some insight into how hard you and colleagues have worked to get that scheme to a point where it looks like it might actually happen, and that's it. I know it's taken an awful lot of hard and demanding work, so I'm grateful for that. let's move on then to what I think is going to be the final item on the agenda, because we've already dealt with 4.3, which is item 4.2, and the Council of Governors annual appraisal. Karen, which is you.
Thanks, Kevin. So I'm really pleased to present the Council of Governors annual appraisal results. I think the report pretty much speaks for itself. The results are set out in quite a lot of detail. Of note, particularly, and I'd like to first start by thanking those that did take part in the online assessment for doing so. We had, as is mentioned in the report, had rather a disappointing response rate last year, so we really encouraged governors to up the ante, and that definitely did work, and we had a better response rate. However, I think we could improve on that even further. So just over half of the governors in post in June, when the appraisal was issued, completed the appraisal. I think given the fact that the appraisal is such a rich and helpful source of information in terms of what you as governors feel or think could be improved on, what we could do to help you more, what more training and development we could provide. I think it's really, really important that we don't see this as just a tick box exercise. It is a regulatory requirement of us, but nonetheless, we don't take it as that. It's actually a valuable source of data and information. So what was pleasing to note was the amount of comments that were provided this year, which were significantly higher than normal. So that helped to perhaps clarify some of the scores that were provided. So we've returned to more in keeping with previous year's results, an overall total of 81%. So it's up there with previous years. Again, I think it's been a really difficult year for governors. I think for those that were in post for the full year, I think they had to adapt significantly to new ways of working. Governors and trust staff and officers were used to meeting face to face. That's been missed by so many people, and I'm quite confident that that's been reflected in some of the responses. However, there is another group of governors that were elected during COVID and the pandemic who actually haven't experienced another way of working. So it's all been virtual and online, and haven't experienced that really great experience of meeting face to face and conducting the business, but also being able to network. As Kevin said earlier, I think that's part of the role. Getting to know one another, and that's been quite limited and difficult to do, although we've tried really hard to keep everybody in touch, and we've certainly continued with all of our meetings. So yeah, I don't really want to say any more, Kevin, about it. I think, as I say, if anybody's got any questions, but again, just encourage people to, when these things are issued, to take part in them. If anyone's got any specific issues that they want to talk about in any more detail, or they don't think are being acted on, then there are a number of people within the trust that they can talk to about them. We're always welcome to hear people's feedback and to offer support where we can. So it doesn't just end there. And the Governor Induction and Development Day towards in another month or so's time, unfortunately, it was planned to be in person. At the moment, that's in some doubt. But if we can possibly and safely meet in person, we will do. So perhaps we can turn the tide on what's been experienced for the last sort of best part, nearly 3 years. So I'll leave it there, Kevin, and I'll open it up to any questions or comments.
Thank you very much, Karen. I've got Emma.
Oh, hi, Karen. Yeah, I was just going to ask about the Governor Developmental Day, because I note that it starts at 9 o'clock, and in my nature of work, that is going to be quite difficult to start at 9, and the fact it also takes me in about an hour and a half to travel to Lincoln.
Okay.
So, you know, I didn't know whether you're able to come later on in the day.
Yeah, Emma, as an existing governor, so what we usually do, the way the programme works for that day is that it is an induction for new governors, and existing governors are more than welcome to join that to refresh their memory and to just hear about things again that they, you know, might just need some reflection on. And then the second part of the programme is for all governors and is more of a developmental piece. So please don't be put off and think that you can't join at any point. It's always difficult. We want to try and get the most out of the event. So it's really difficult finding a time that suits everybody. But you're not, please don't think you can't attend because you can't join at the very start.
Okay, lovely, thank you.
Okay.
Thanks, Emma. Thank you, Karen. I mean, there's loads of information in this, which I mean, I would suggest that we'd want, or the council would want to keep in view during the course of the year and reflect on over time. But are there any other questions or comments for Karen? No, I don't see any. I think then that concludes the agenda for this afternoon. I haven't been notified of any other business that colleagues want to raise. Has anybody got any other business that they wish to raise? In that case, then, you just got in under the wire, Karen. Well done.
Sorry, Kevin. It was just, I know everyone, well, some people will have seen the invite come out, but just to let everybody know formally that unfortunately we have moved the next joint board meeting on the 1st of September to a virtual event. So apologies, but just to tell anyone that hasn't clocked that yet. Thank you.
That just for clarity's sake, that was my decision, and it just maximises the chances of it actually happening. So that was why. Excellent. Thank you very much, everybody. Thank you for your time and attention, and see you next time.
Thanks, everyone. Bye now.
Cheers.
Bye.
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 Bye. Sorry I was late, but at least I got there in the end.
I was going to say I was surprised to see your name pop up, Helen, because once you were coming, then you weren't, and then you